everyone, I'm Dr. Loharan. I'm a board-certified Atlas orthogonal chiropractor. This week's episode is going to be really special because we are actually doing a live case study on our very own Dr. Kathireson. We have partnered with Regenerative Wellness, which is a naturopathic office that is down the hall from us. We have worked with Dr. Drain on a number of regenerative cases. We have used our Erconia low-level lasers in conjunction with adjusting and his PRP treatments. So we thought it would be really cool to follow a patient as they go through getting PRP injections, rehab protocol, and doing low-level laser and seeing the results from the beginning of treatment to the very end. And our lucky patient is Dr. Kathireson. Dr. Kathireson has struggled with knee pain for a long time. He had an injury that tore his LCL and meniscus a while ago and has ever since had issues with stability in his knee, as well as pain if he overuses it. So we're going to follow Dr. Kathireson as he gets his PRP injections in this video. This video is going to show the entire process, so the blood draw, spinning of the centrifuge, as well as the injection. So if you're a little bit squeamish, then we might want to skip over some of those parts. The timestamps are linked below. And I will be operating the camera instead of being in front of it, so you will be hearing from Dr. Drain as he explains what PRP is and walks you through the whole process, and from Dr. Kathireson's reactions himself. Okay, let's get to it.
Hi, my name is Brian Drain. I'm the naturopathic doctor here at Regenerative Wellness, and today we're going to do PRP, which is platelet rich plasma, on Dr. Shane's left knee. And so what we're going to do right now is we're going to draw 2 vials of blood, and then we'll spin it in the centrifuge. Okay, breath in, and then breathe out. Little brush here. Great, you okay?
Oh yeah, wow, I didn't even feel it.
Okay, great. Like so. So, we just need 2 tubes here. It'll be like probably 8 cc's of blood, and then we'll spin it in the centrifuge, and then we'll end up with about 4 cc's of plasma, and that's what we'll use. 4 cc's will go into the joint capsule itself, and then we'll have another 4 cc's to do the lateral ligaments there. What we have here are the vials full of blood, and so what we're going to do now is centrifuge them for about 15 minutes. And so what the centrifuge is, it's just a machine that will rapidly spin the blood round and round, and when it comes out, all the red blood cells will be at the bottom and the plasma will be on the top. All right, we'll see you in 15 minutes. So it's been 15 minutes and the PRP is now ready, and I'll show you. You can see that all the red blood cells are now at the bottom of the test tube and the plasma is at the top. So this is what we call platelet rich plasma, and what that contains is there's nutrients in there, there's some of our immune cells, and there's also cytokines. Cytokines are cell signalers, but what we're going to do is get this plasma into a syringe, and then we're going to inject it into his knee, and the plasma is going to stimulate a stronger, robust healing response because of the immune cells and the cytokines in there. Great, stay tuned. All right, so now we're going to get the plasma into the syringe that we're going to use to inject. We'll probably end up with about 3 or 4 cc's. So yeah, just like that. to do now is we're going to mark the location of where we're going to want to inject. We're going to the eye of the knee. We'll start with one pass with alcohol, use some betadine, then alcohol again. Great. So we use a little bit of freezing spray here. So Shane, you're going to notice it's going to be cold. Does it feel cold?
Yep.
Okay.
Good.
So have a breath in and then breathe out. Feel a little pinch. Tell me how you're doing.
Doing great. Actually, barely feel bad.
Still doing okay?
Doing great.
Okay, so we're now in the capsule. So now I'm going to start slowly putting in the plasma, and you should feel like a pressure. Do you have any sharp shooting pains? Do you have any sharp shooting pains? Okay. Do you have sensation pressure? Still pressure. Okay. Pressure. Okay, that's what I feel. I know we're in the capsule because the plasma is flowing very freely to the joints, and we're a quarter way left. So feeling okay? Okay, great. So we're almost there. And then what we do is trap and hold a little bit of pressure. Okay, so still tight. Perfect. Now hold pressure now. Feeling okay?
Yeah, feeling great.
Great.
Wow, I thought it was gonna be much worse than that. That was not bad at all.
Okay, and then we're gonna go ahead and have a breath in, and then breathe out. Do a little poke. Okay, you okay?
Oh yeah.
Now we can put a little bit of plasma in here. This is where it's gonna might be a little uncomfortable. You can tell me how you're doing, Shane. Don't feel dizzy or lightheaded or anything?
No?
Perfect. Okay, that's it. So I'm gonna pull the needle out. So put a little pressure on here. Sting a little. Okay. So again, I'm just gonna kind of move the joint so it'll help move that plasma around in the area. You don't have any sharp shooting pains? Don't feel dizzy, lightheaded, anything like that?
No, it was definitely worse in my head than it actually was. It really wasn't that bad.
Okay, so that's it. Okay, so that sensation of pressure that you feel, it'll dissipate probably after 3 or 4 hours. The body will just kind of reabsorb it. So, and the reason why you feel pressure right now is because we just injected 4 cc's of plasma into a closed space. So it's going to kind of like a balloon. Okay, so that's why you're going to feel like that. So what's happened right now is we just injected the joint with a needle, and the fact that we injected it with a needle is going to stimulate the immune system to come in and heal. Just the fact that we just poked the area. However, that healing response is going to be more robust because there's plasma in there. The plasma has those cytokines, which are cell signals to other immune cells to come into the area and heal better. There's also nutrients in that plasma. There's also some of our own stem cells in there. A lot of the times why ligaments, tendons, joints don't heal well is because there's no blood supply. Generally, blood brings in nutrients and oxygen. In joints, that's why joints and ligaments and tendons are white, because there's no blood. And so we can stimulate the healing response and then just kind of circumvent that character of our body's makeup by injecting the nutrients right in there. And so that healing cascade, it's going to take about 6 weeks for right now. Okay, so for the next couple days, you might want to take it a little bit easy because it might be a little bit inflamed because we just poke it. So maybe take it easy for a couple days. One of the main things after having PRP is no anti-inflammatories, because inflammation is actually good in a sense. That's kind of the body's response to bring in like healing nutrients. So don't quell that process. If you take any, like, even their supplements and other things that are anti-inflammatory, turmeric, don't take. CBD products, don't take. But definitely like acetaminophen, don't take. You can take Tylenol, is okay if you have pain. Of course, rest, ice, elevate it. And then after that initial kind of 2 or 3 days of rest, whatever baseline activity you've been doing up to this point, so if you've been running or working out or something like that, you can continue that, during that healing cascade of 6 weeks. However, say at 3 weeks, if all of a sudden there's no pain, just still take it easy. Like, you still need to give your body that full 6 weeks. Now, on a pain scale with 1 to 10, 10 being the highest level of pain, when you were having symptoms of your knee, being uncomfortable, what number were you at?
When it at its highest, I would say like a 7 out of 10.
Okay, 7 out of 10. Okay, great. So to determine how many sessions of PRP you might need, is you wait that full 6 weeks and then just kind of reevaluate where you're at on that pain scale. So if you were at a 7 after this treatment, if you go down to a 4, great. That means that it is working. And if you're fine with being at a 4 pain level, then you don't need another treatment. However, if you want to go down from a 4 to potentially a 1, then I'd have another treatment. Okay.
Pretty cool stuff, right? That concludes today's video. We're going to let Dr. Kathireson rest for a few days, and then he's going to start doing integrating some of his rehab, and then of course doing laser on the knee. We will be doing weekly follow-ups in our shorts. So if you're curious to follow along with Dr. Kathireson's progress, hit that subscribe button and the notification bell so that you know every time we post an update on how he's doing. If you found this video helpful, please give it a thumbs up and share this video with your friends. Maybe they don't know about PRP and the possibilities of regenerating ligaments that are torn so that you can get out of pain and have more stability.